You are listening to Skin, Earth, Vitality, the podcast where ancient wisdom meets modern vitality. If you are seeking to reconnect with your innate vibrancy, you're in the right place. I'm Emily Davis, a seasoned holistic esthetician and herbalist. Join me as we unlock the secrets of ancient skincare practices, explore the beauty of seasonal and nature-based living, herbalism, and true holistic well-being for you and the broader ecosystem. This podcast is brought to you by Stratum Aesthetics. Head to stratumaesthetics.com to find curated skincare, body care, and other wellness products hand-selected by me. Now enjoy the show. I have a treat for you today. I interviewed Dr. Keira Barr. I found her on Instagram, like I find so many of my colleagues these days. And when I first came across her work, I was like, whoa, who is this amazing goddess? I have to know her. And I was so tickled that she wanted to be interviewed for the podcast. I am just so excited to bring this episode to you. This episode is for you if you are interested in how the mind affects the skin. Dr. Keira Barr is a trailblazer in holistic health, seamlessly integrating her dual board certified dermatology expertise with profound educational and empowerment initiatives. Certified in integrative dermatology and mind-body medicine, she excels in teaching stress management and skin health enhancement from the inside out. Her unique approach combines somatic trauma therapy, stress release, and breath work, making her a favored resource for those seeking empathetic, evidence-based healing. A globally recognized keynote speaker, Keira frequently graces international stages and features in prestigious media outlets, sharing insights that bridge clinical science with the human experience. Her transformative sessions provide a comprehensive blueprint for vibrant living, empowering individuals to embrace holistic health confidently. Keira is more than a physician. She's a mentor and educator dedicated to redefining skincare, health, and wellness. I have included in the show notes, so if you just click right below the episode, the links to connect with Keira. If you are interested in working with her, you can find that there. So I hope that you enjoy this episode, and I will see you on the other side. Dr. Keira, I am so grateful to have you here. I want to get started with asking, what is like your go-to self-care or wellness ritual that you can't live without?
I would say it's movement of some sort. I used to be an ultra marathon runner, and I realized that kind of movement was not good for me. I learned that the hard way when my body kind of fell apart around the time that I was really running a lot of races. But I find that for my mind, for my body, to clear my head, all of it, like I cannot go a day without doing some sort of movement.
That's so good. That's such a great one. Well, welcome. Thank you. I would love to, so I've already introduced you in the beginning, but I would love for you to tell us about yourself, about your background, and how you got to where you are now.
Yeah. I would say like when your mess becomes your mission in a way, like when things fall apart, you figure things out, and it really does change the trajectory of your life in ways that you never expected. So, traditionally trained in dermatology, did a fellowship in dermatopathology. I was in academics. But as I mentioned, I was running ultra marathons, I was juggling kids, career, all the things, and my health just started to unwind. And it really started with my skin, actually. I'm a brunette, but I have a lot of moles. My dad's a redhead, got lots of sun damage as a kid. And so my skin was changing, growing and changing pigmented lesions every couple of months, getting biopsies, and they were getting more and more atypical and irregular until one, I had a diagnosis, early melanoma. And
Mhm.
that really was the wake-up call that things were not quite right. And then it was gut issues and it was hormonal issues and it was one thing after the other. And it led me down the path of functional medicine, integrative medicine, taking all the supplements, trying all the protocols, elimination diets and things. And then I found myself landing in the world of mind-body medicine. And that's when it all started to make sense that all the dots that seem to be completely separate, like the gut issues, the hormone issues, the skin, all the dots started to connect when I realized that the mind and body truly are connected. And the common theme of all of it was stress in all its various forms, the environmental stressors, the personal care products, the food I was eating, the thoughts I was having, the stored, emotions in my body, all of it. And it was being expressed not only in symptoms in my body, but on the surface of my skin. My hair was starting to, increase shedding and falling out as well. There was just so many signs and symptoms. So it really led me to where I am now of looking at the skin from a completely different lens of, the impact that chronic and traumatic stress has on the body that gets expressed in the skin, and how do we navigate that and manage that.
Wow. How young were you when you first had that diagnosis?
So not that young. I was 39. I was 39. So, and yeah, and I didn't know at the time, right? Like I'm a physician, had been in medicine for a really long time at that point, but I had no idea really. I mean, I didn't understand my body and I didn't understand that in my mid to late 30s, I was probably already heading into perimenopause. And then all the stress of over exercising, the mental emotional stress of not feeling like I was being respected in my job and all the things um, just kind of pushed me over the edge and really led me into hormonal imbalance with sex hormones and thyroid, and certainly the elevated cortisol, and was exacerbating all of that. So, yeah, I wish I'd been younger in many ways because I would have learned these lessons a lot sooner. So,
Yeah, what a beautiful way to come to it though, and a way to take something that can be so terrifying and make it into your life's work. I think that's beautiful. How do you define the mind-skin connection?
yeah, so many people may not appreciate like the brain and the skin are derived from the same layer of embryologic tissue. So there is that innate connection in our biology, and the two are communicating with each other all the time. So I've been looking forward to having this conversation with you for a while. But I'll admit, like my palms are a little bit sweaty, my pits are a little bit sweaty right now. Like that is real time. My brain and my skin are talking to each other.
Totally.
Right. I mean, we don't think about it, but when we flush, that is that mind-skin connection. And what many people may not appreciate is, when we think about stress, like the mental and emotional stress, we always think of it as being like a top-down, like from our brain to the rest of our body with that hypothalamic pituitary adrenal axis, and like release of the stress hormones, cortisol, adrenaline, norepinephrine, and then sending signals to the rest of your body. But your skin actually has its very own HPA axis. So your skin is both a target and a source of the stress response.
Mm. Can you go into a little bit deeper of what that means as the skin being a target of the stress response?
Yeah. So when we think about stress, right, our body is wired for survival. So stress in and of itself is not a bad thing, right? Stress is a normal physiologic adaptation to a stressor, whether that be UV light, environmental exposures, again, mental and emotional stresses. And so that signals the body to release additional inflammatory signals like cytokines and such.
Mm.
Um, and the skin can receive those signals. The skin has its own capacity to generate cortisol, norepinephrine, and epinephrine, right? It can generate on its own because it has its own HPA axis, its own stress response system. It is capable of making those stress hormones as well.
Wow, I didn't know that.
Yeah. So if you think about the bigger picture, our skin is part of what we call the NICE network, right? So there's the nervous system, there's the immune system, there's the cutaneous system, and the endocrine system, right? Or hormones. And they're all interconnected. And I always think of our nervous system as being command central. And so when there is a real or perceived threat to the system, right, whether that's a product that might be applied or, an email that, your inbox is full or whatever it is, your nervous system is going to, alert the rest of the systems that it's involved with in order to ready itself to prepare for whatever action needs to be taken next in service of our survival.
Mm.
So your skin also is a perceiver of, cues of danger as well and can mount its own kind of stress response. So it gets it from the top down, a centralized communication as well as creating its own activation and hormone production.
That is fascinating. I did not know that. There's so much about the skin that I feel like the longer I do this, I've been doing it for almost 20 years now. The longer I do it, the more I'm like, oh my gosh, there's so much to know.
Both, you and me both. I mean, this is what's so amazing. And we're learning more and more. I mean, we've known like the field of psychodermatology is relatively new, about 40 years, right? And that's really the intersection of mental health and skin health. But we have known about this connection for much, much longer than that. But for the most part, it was psychology and psychiatry that really were managing a lot of the symptoms and challenges that people were facing when they were struggling with chronic skin issues. So in the aesthetic world, in the dermatology world, we weren't really having to manage it. It was more of like, okay, you have this diagnosis, here's your treatment, bye,
Yeah.
right? But we know that the mental and emotional piece is such a significant component. In the scheme of things, if you think about heredity, like a pie, right? There's your genetic inheritance of what you may be more susceptible and vulnerable to. There's our lifestyle factors. Those two may take up most of the pie. And you have a small sliver that may be the mental and emotional piece, the stored, the traumas that we've had. But it's probably the most critical because it's the linchpin that will allow whatever actions that you're taking or whatever products that you're using to really work that much better or maybe not work as well as you thought they would because of that interconnection of all of those networks
Mm.
and
Yeah.
that system. And because when we talk about trauma and stress, right, it's not in the event, right? It's actually in the nervous system. Like if stress is that normal physiologic adaptation to a stressor, if we think about trauma and the current understanding of it, trauma is not the event, it's the inability for our nervous system to adapt to the stressor. So many things can be perceived and stored in the body as trauma that we wouldn't otherwise have recognized, right? It's not always those big T traumas, and this is why not everyone who goes through a similar, seemingly catastrophic event will respond in the same way because their nervous system may be more resourced at the time. They may have more support in their friends and family, in their community, or even their internal resources of resilience that help them get through it. And so all of that will have an impact on how activated your immune system, how overactive it might be in terms of, creating inflammation, irritation, shifting the microbiome in the gut, and on the skin as well.
Okay, you said so many things that I want to tuck into. That's
I know I
so
talk a lot.
amazing.
I jabber a lot.
No, that was so good. So, first thing you mentioned psychodermatology, and correct me if I'm wrong, this is what you would call your specialty,
Yes.
correct? What, which I find I have never heard of that before. Which is why I just was so enamored with you when I found you on social media. And I love that you do that because it just makes so much sense. It resonates with me so much. What exactly is psychodermatology and how, I mean, you kind of mentioned how it's different than conventional dermatology. Is there anything else that makes it different?
Yeah. So psychodermatology, again, it's that psyche is the mind, derm is the skin. So it's really that intersection of where the skin and the mind meet, really highlighting that mind-skin connection, which we know they have such an intimate two-way communication because they are biologically connected and part of that larger system. So there are different categories of conditions in psychodermatology. There's the ones that I primarily work with clients where stress can either trigger or exacerbate a condition or result from living with a condition, right? So conditions like eczema, psoriasis, acne, rosacea. We know that when there's stress in our lives, whether it be personal, professional, people will share, whenever X happens, I break out, right? Um, or things like alopecia of various sorts, whether it's scarring alopecia or non-scarring alopecia, vitiligo, where the change in appearance can create a significant amount of stress, right? Because, and hidradenitis is another condition where there may be pain, there may be, it interferes with interpersonal relationships, feeling judged by the outside world because we live in a society that unfortunately, whether we want to acknowledge it or not, it really does use our physical appearance as a metric of our perceived worthiness, which is so unfortunate. And I really hope in my lifetime that we can shift that. Um, so that's a big category of conditions that are addressed in the field of psychodermatology. There are also conditions where there may be a primary psychiatric diagnosis or condition that then kind of triggers skin manifestations. If someone is having psychosis or illusions, there could be conditions that may go along with that, picking, scratching. And so there's different there's three essential categories, but the one that I think that we see most talked about on social media is really the aspect of psychoderm where it is the stress that contributes to triggering or exacerbating a condition or results from living with a condition, right? There are certain meds that can also create challenges as well. But I would say I would say that section that I just mentioned probably covers a lot of people who struggle.
Yeah, I agree. So, going back to everything you were saying before, talking about people being resourced, how can somebody resource themselves and support themselves so that when they are experiencing either big T trauma or little T trauma, that they are not holding on to it in their body in that way?
I think that's a great question, and it's multifactorial, right? So we oftentimes look outside of ourselves for support, right? So community, friends, family, providers, right? Because we are not meant to do this alone. So having, again, support, whether it's personal or professional, can be really helpful. Um, the internal resources that we rely on really is a matter of, can we even recognize that we are in a state of activation? You know, the beautiful thing about our nervous system is that it is wired in service of our survival, and it's always scanning for cues of danger. Um, and it mobilizes responses to that, whether it be fight, flight, freeze, fawn, in order to keep us out of harm's way. The challenge is a lot of those coping strategies uh, go on for longer than their usefulness.
Mm-hmm.
And so many of us operate from a state of hypervigilance, of always being on, always being tense, and we don't realize it.
Mm-hmm.
That's just our normal. So I think in terms of resources, it's that curiosity and increasing that awareness of even recognizing, what does stress even look like in my body? Because the way I manifest stress may be very different than the way you do. Like for me, I hold it in my shoulders and my jaw. Other people, it may be a lump in their throat, or a knot in their gut, or some other thing. So in terms of being resourced, it's first understanding how, how is this landing inside of me? Because then that would inform, what might I need to do to support myself through this,
Mm-hmm.
right? Our breath can be an incredibly powerful resource, because when we're talking about nervous system activation, that sympathetic drive, that fight or flight, the balance to that is parasympathetic nervous activation, activating that vagus nerve, which helps our body rest and restore. Our breath is the fastest way to do that, by bringing it under our conscious awareness.
Mm-hmm. Do you have a favorite breath pattern that you like to use yourself?
Yeah, I think it's so simple. Number one, I always check in, am I even breathing? Right? Because when we are stressed, or something surprises us, or shocks us, our first inclination is to hold our breath.
Yeah.
Just even bringing that awareness to the breath. And then when I do that, okay, I'm breathing. How am I breathing? Is it shallow? Is it deep? Is it in my chest? Is it in my belly? But then just inviting an extra long exhale, because our inhale naturally, it's activating a little bit of that sympathetic drive. The exhalation triggers the vagus nerve and the parasympathetic drive. So if you can invite just a little longer exhale, you can invite a little more of that rest and relaxation. So that's the simplest way to do it, is just inviting, a little longer exhale. But there's so many different practices, like, balance breathing, maybe counting in, inhaling for a count of four, exhaling for a count of four. The 4, 7, 8 breaths. Oh, there's so many, right? There's no right or wrong way to do it, but I just find just checking in with my breath and just inviting an extra long exhale usually helps me pretty quickly.
I love the question, am I even breathing? Because I never ask myself that question, but I often find that I'm like, oh, I haven't really, or I've been doing really shallow top of lung breath for a really long time. Like when did I stop breathing fully? Um, let's see here. So, can you talk about what somatic skincare is and what that really means?
Yeah. So soma is derived from the Greek word, the body, or the body living in its wholeness. And from my perspective, when we talk about skin, right, we've discovered that skin is this amazing organ, right? It's an endocrine organ, it's a sensory organ. It's also our ultimate boundary between our internal world and our external world. And as such, it is in relationship to everything that we think, feel, and do, with the products that we use, the people we encounter. And so when I think about skincare, it's all encompassing. It's really about relationships, relationships, um, to my thoughts and feelings. It's the relationships to the people in my life, to sleep, to food. So inside somatic skincare, it's that experience of what is it like to live in this body, to live in this skin of mine, and how are the things in my life, in my environment, impacting my skin and how I show up in it. So when I work with clients or take them through, we just finished an exciting group program for a specific skin condition, and I just got IRB approval for a study to actually use this program for this particular skin condition. So I'm super excited about that. So we look at relationship to self, we look at sleep, we look at our environment, the things in our environment, right? It's not just the products, but our visual environment, and other aspects, nourishment, right? How do we nourish ourselves, not just food, but in other ways? Stress, right? What are the stresses in our lives and how do we manage it? Movement, exercise, and then, of course, the topical things that we put on our body. And with each of those curiosities, learning a mind body practice that supports nervous system regulation, right? Because we want to make sure that Command Central is sending out positive messages to the other systems so it stays functioning optimally. So it's lifestyle, it's mind body practices so that we can build resilience from the inside out and nourish the skin from the outside in. So, yeah.
I love that. You are speaking my language. I always say skincare products are the icing on the cake, but the cake itself is your lifestyle, your mind, body, all of the things. Speaking of products, what are your favorite topicals?
Yeah, so I'm very simple. I am not a product junkie at all. Again, like when I was practicing traditional clinical derm, I was behind the microscope. So I was not doing aesthetics. I was not um so I like a gentle cleanser, really. And I always say, listen, if you can only wash your face once a day, do it at night so that you can wash off all the dirt and grime. I use a antioxidant serum with vitamin C, vitamin E, um, other ingredients sometimes in there too, but those would be the two main ones because the research on the synergistic effect of those two together. And then a tinted moisturizer with sunscreen is part of my daily routine, and specifically the tint because we know that visible light can also impact the skin. Right? So hyperpigmentation. And so the tint blocks that visible light. And then in the evening, similar thing, wash another round of the antioxidant serum and then adding in something that can help skin cell turnover or a little extra moisture if my skin is dry. So a retinol or sometimes if skin is a little more irritated, something like bakuchiol, which in head-to-head studies, bakuchiol versus retinol, very similar outcomes. So yeah, pretty basic, pretty simple.
I love that is holistic esthetician approved because I'm a big fan of skin minimalism.
So
Yes.
yeah, I'm all for minimalism. I appreciate that. I'm trying to be more minimalistic in all aspects of my life.
So good. Good for your mental health too.
Yeah, yes. And that is the older I get, the more of a priority that is becoming. Because I just celebrated a birthday and I realized, oh, as much as I do this work, I literally need to do this work because, just like your skin, there's so many layers. And you might exfoliate and you might shed some stuff, and then, oh, there's something else. And so realizing that there's still some stuff left that I'm more than happy to work on getting rid of.
Yes. So for someone listening, how could they tap into the symptoms that may be showing on their skin, whether they have acne or perioral dermatitis is a big one I've been seeing in the last few years. to deeper understand what their body might be holding on to.
So this is great. So again, it's multifactorial. And I think, especially when it comes to skin, there's a lot of discussion of like the gut, skin, brain axis, like heal the gut, heal the gut, heal the gut, right? Get rid of this food. Like, you got to heal your gut, which of course I wholeheartedly support that, but I'm always so curious and want to back it one step up to say like, well, why is your gut so out of balance in the first place? Why is that microbiome? Why is there dysbiosis? And it all makes sense in the context of stress, right? Because when our body is under chronic stress, and right, like I said earlier, stress is not this big bad elephant in the room. We need to activate our stress response to get us out of harm's way. The problem is being under chronic stress and not realizing that just becomes our norm. And so when we are in the state of chronic stress, like our body is going to be prioritizing survival. So we just need to have fuel and energy for our brain, our heart, our lungs, and our muscles. Digestion, fertility, not a priority.
Mm.
So when we are chronically stressed, like digestive juices aren't flowing. Gut motility is going to slow down. There's likely going to start to be imbalances between the good bacteria and the bad bacteria. And we know that certain bad bacteria produce things like lipopolysaccharides, which can poke holes in the gut lining. Then your gut becomes leaky. Then there's inflammatory signaling, and your skin has receptors for that, right? So, yes, things like psoriasis, rosacea, acne, we know that there's a gut skin axis. But if you, and that's a good place to start. But getting really curious of like, well, what is it? Let's just say I remove some things from my diet, I take some supplements and try and rebalance things. How am I going to prevent it from happening again?
Mhm.
And that's the invitation to do the deeper work of like, well, where else do I need to look in my life? Right? If you think of this skin as your ultimate boundary, where is it leaky? With whom might you need to have conversations with? Is it a personal boundary? Is it a professional boundary? Is it a boundary of you not respecting your own needs, not using your own voice? Right? So that's where I would get really curious. Because downstream, yes, your immune system may be overactive or underactive. This is where autoimmune conditions come in, right? This is where gut issues come in. This is where fertility issues, PCOS, and a whole host of other things come in. And I always think maybe it's simplistic, but the more I learn, right, I realize how impactful our nervous system is to how our entire body functions.
Mm. That is good. On that note of stress, what are some of your tools that you use to either mitigate the stress in your life or help your body to be better adaptable to the stress that we can't avoid?
Yeah, so this is where the somatic work really comes in, right? So soma, again, the body. If you think about the language of the nervous system is sensation. The language of the body is movement, not just physical movement, but right, the body is always constantly in motion, blood flowing, moving through our vessels, the lymph flowing through our lymphatic system, digestive juices, all of that. So everything is always in motion. Your skin is an expression of how those other two are truly communicating, right? So it is the most visible expression of what's happening, but it often is the last to get the message, right? Things have been going on for a while here. So I always like to come back to the body, right? Most of us have been taught like the head is disconnected from the body. I have had so many clients that I was like, all right, so what are you feeling in your body? They're like, what body? I don't, because they live up here, it's all thoughts.
Mm.
So I think a big part of it is, getting familiar, getting more comfortable of noticing the sensations that are in your body, to know what tension feels like, to know where stress shows up, how it shows up, and then working with the body to move that energy through. So sometimes it is like big movements, sometimes it's macro movements, sometimes it's just a noticing. But again, I do a lot of breath work, visualization, various forms of meditation, but it always comes back to what is your body actually saying, right? That expression of like the body expresses what the mind suppresses.
Mm.
So I've had a lot of clients who even they're saying like I just can't, like, I don't know if people can see what we're doing, but like I just can't slow down, right? And their hands are moving so fast. And I'm like, okay, if your hands are moving this fast, I can only imagine what is happening in your head and in your body. What if we were just to slow that down just a little bit, right? And they begin to slow it down. Their breath begins to slow down, their heart rate begins to slow down. And then we can get really curious. Well, if your hands could really talk, what would they say? Right? And oftentimes a very clear message will come out. Like I'm holding my hands like this, but there are times when people are putting their hands out and they're like, I just can't stop something, or I didn't get to stop something back there back then.
Mm.
Just want to say no, right? And we might even work with that. What would it be like in your body if you could say no? How would your body express no? Right? Again, skin is the ultimate boundary. So there's a lot of different ways, but I think oftentimes we can get so stuck in our head and get caught in the story and the thought loops that if we can just be open to the possibility that we don't have to actually think anything, we don't really have to do anything, we can just listen and be observant of how our body is communicating, it'll help us move that stress and energy through.
Mm. I love that question. What would my body be saying right now? Mm. How do you feel like touch affects all of this and affects the skin and self-massage or massage from others?
That's a great question. And what's really exciting is there's a lot of research in this area. So I think both are fantastic, right? Not all of us have the luxury of going to someone to get a professional massage. Maybe we live alone and we don't have access to someone who would kindly lay their hands on us. So our hands are these amazingly powerful tools. And, you know, in some traditions, the hands, right, are thought to be extensions of our heart. So we can give ourselves some self-love and self-care with these beautiful hands of ours. The skin, again, amazing organ, endocrine organ, sensory organ. We have so many nerve endings on our skin. And there is research on a certain type of nerve ending called an afferent C tactile fiber. And so there are studies that show when you use slow stroking motions as similar to what you would receive in a massage, that the um, sensation that's picked up by the nerve endings communicates with a part of our brain that's tied to emotion, and it can help shift out of that fight or flight mode into that relaxation mode, and link it to more positive emotions of love and compassion. So touch, especially self-touch, can be an incredibly powerful tool. And I actually teach my clients this because it can be so soothing, especially because I do a lot of work virtually. So I will just guide someone, right? And just even experimenting on yourself. Okay, is there a place in my body that feels more tense or would like to receive my hands? When you get curious, there'll be a part of your body that's like, pick me, right? So you can lay your hands there. And then also get curious even more of like, okay, light touch or a little more firm touch, right? Without moving your hands off your skin, just pulling and like, which way does the fascia want to move, right? This interconnected web, this fascia, we're learning so much more about it, and just getting curious. Okay, where's my skin saying yes? Where is it saying no? Can I yield to the yes? And just allowing your hand to move in that direction. And I'll name that when I started doing this practice, this like dynamic kind of somatic touch practice, I could just feel my body just kind of coming down a couple of notches, right? Just relaxing, which is amazing because you could do it anytime, anywhere. You could do it sitting at a traffic light. You can do it standing in a grocery line when you're really starting to feel a little irritated or agitated because even though we're no longer under, COVID restrictions, I find I don't like people around me as much as I used to, right? So when I feel people are getting a little close, I might use a little self-touch just to provide a little soothing to my body and my nervous system. So I'm a big fan of touch and can use it in many different ways.
That's beautiful. With the fascia, is there anything else that you can share about how that relates to psychosomatic dermatology? Because I do feel like it's such a communication network, but I would love to know more about what you have to say about that.
Listen, I am not a fascia expert, but the more I learn, right, that communication and when the fascia is, again, the body is holding tension. It's holding it, right, that stored emotion. The fascia is part of that network. So I think it plays a role in all of this, that mind body connection, that mind skin connection. And so being able to use touch to help facilitate a little bit more movement in the fascia can be really helpful. There's a lot more research coming out. And again, I'm excited to bring this stuff forward. We're hopefully going to put out a paper about how adverse childhood events um, have a contributing role to skin issues, right? That stored tension from way back then, right? When we look at something even like hives, chronic hives has gotten a lot of attention lately. And it's hives are, itchy red bumps that last longer than 6 months is the definition of chronic hives. There's even some biologics that are being used now. But when you actually take a history of someone who is struggling with the condition, maybe not everyone, but the women that I have spoken with recently, when you ask when did it start, or are there other situations when this has come forward, or what feels familiar about this? So commonly, we start at the surface, right? What's happening on the skin, and immediately go beneath the surface of I don't feel heard. I don't feel supported. I'm trying this new thing in my life, or I'm changing jobs or changing relationships, and I just feel like no one is listening to me. Interesting, because your skin is shouting right now. Your skin is shouting, right? This idea of like what actually is happening. And when you get a history, you know, in a lot of conditions, there is a history of emotional neglect, right?
Mhm.
So not being seen, not being heard, not feeling valued or validated. That happens enough times, and you don't have the time, space, or support to be able to work through that stress response and complete it. It can get stored in the body and eventually gets expressed on the surface of the skin. Now, some people say, well, why doesn't everyone have skin issues, right? You think about it from, okay, well, what are people's like path of least resistance? For some people, it's the skin. Other people might really struggle with gut issues. Other people may struggle with, Hashimoto's or some other autoimmune condition. So it's not absolute, but the skin often gives us clues as to what's happening beneath the surface. I do think that can be also tied to the lack of movement or what gets stuck in the body. And that's where the fascia can come into play.
Yeah. What does it look like for a client to or a patient to work with you? I know that you said you work with people virtually. For someone who's listening, who's as enthralled as I am, who maybe has skin issues that they've tried everything and really haven't gotten to the root cause, what does that look like?
Yeah. So, yeah, I do have the opportunity to see people locally in my state of Washington, but I see people kind of all over the world because this is more of, a guide. It's education. It's sharing skills, right? So I'm not having to diagnose. I'm not, prescribing anything. What it looks like is a conversation to begin with. I think what's different about somatics is it's a combination of the conversation, which is more of a top-down approach of really understanding, getting curious about what's happening, and then that bottom-up approach of what's happening in the body. So we get really curious about, you know, when did this start? What are the things that may be impacting it? More practical, strategic aspects, right? We talked about diet and lifestyle and things like that. But it really evolves into resourcing people. What are the resources that they may need to help bring more regulation to their system, to help navigate the stressors in their life? And that may look very different for people, but it's very personalized and tailored to their own unique experience. But really teaching people how to become more aware of what's happening in their body and then giving them the skills, tools, and resources to be able to work with that, increase their capacity to be with it, right? I think in our Western society, we're so quick to like fix it, to cover it up, to camouflage it. And that's not what this is about at all when I work with people. We're not trying to fix anything because nobody is broken. We're just trying to help them understand that they make sense and how they make sense of what's happening and what has happened so that they know how to move forward, feeling empowered that when they do feel stressed, they know exactly what to do. Right. When their skin does break out, it's not something has gone wrong. It's like, ooh, how might I invite myself into some curiosity? What might I need? Like, what kind of care can I offer myself?
Mm. That makes me want to cry. I'm so grateful to live in this time where there are people like you that I can send my clients to. And I hope aestheticians listening, because I do also have many esties who listen in, will consider partnering with you and referring clients to you as well, because I think it's such a beautiful tool in the toolkit as well. And it's just, I haven't seen a ton of people who are doing what you do, and so I'm just very grateful that you are sharing your medicine with the world. I want to be respectful of your time. Are there any other topics or notes that you wanted to add before we wrap up?
I think so. I mean, I too am grateful, right? It takes a village. I can't do what an esthetician does. And I think estheticians, I was sharing, right? I just spoke at a conference where I had the privilege of speaking to a group of estheticians because you are in a very unique position where you may be the only person who gets to lay your hands on someone and you have that gift of time. Someone is on your table, open to hopefully receive. And so bringing this understanding and some of this to your own work can be really powerful because obviously you have skills and they're great products. Um, but to even improve those outcomes, right? That mind, body, skin piece really is exciting. So I would just say that, yes, I would love to partner and collaborate both ways because you're in such a unique, like being able to use these magical, tools, these hands. So I think, yeah, I just think it's important that we continue the conversation, that we collaborate because people really deserve um, care like this, and it's kind of what's been missing for a really long time.
I agree. Well, thank you so much for your time. Thank you for your wisdom. That was just so, so good, as I knew it would be. And I am so grateful. And we will be back next week. Until then. Be well. You've been listening to the Skin Earth Vitality Podcast. If you like what you heard today, consider giving me a 5-star rating. It helps other people just like you to find the show. You can shop products and find all of my offerings on my website, stratumaesthetics.com, and follow me on my social channels at Stratum Aesthetics.